seems like one of the things that's been a core part of President Obama's vision for this country has been kind of integrating a new information infrastructure, right? A wholesale broadband rollout. You know, with your role on the House Energy and Commerce Committee, specifically the Communications, Technology, and Internet Subcommittee, you all have been busy.
We've been busy. We've been busy. We've been busy on all of my committees, because I'm on the Health Committee. We just passed about 12 or 14 bills out this morning out of committee. Oversight, yesterday we had a hearing on the salmonella, and of course on telecommunications and the internet, so many issues, but really trying to ensure that broadband is available to everyone, and then once we get it to where it can reach everyone, to make it easy for people to adopt it. It's interesting, people are concerned about costs, so we have to make sure we can do something about costs, and the Federal Communications Commission is trying to do that. We're looking at the Universal Service Fund as a way to help that. But people are also don't see what it does for them enough. So there's a lot of education, and I know that there are some applicants who really have access to the Black and minority communities that can really help with that. But yeah, so that's a really important part of improving people's lives going forward, in addition to healthcare, because you have, through broadband, you have access to healthcare, you have access to job information, and for people who may want to get into business, it's a great opportunity. You could do it from your home.
Right, yeah.
If you have a service, if you have a product, broadband will help you market it. And just as a statistic, a study by Connected Nation, they determined that just a 7% increase in broadband adoption would create 2.4 million U.S. jobs, save 662 million in healthcare costs, and 6.4 billion in vehicle mileage, and have an annual positive economic impact of 134 million.
Wow.
And of course, we're dealing with climate change in my committee too, so that 6.4 billion reduction in vehicle mileage also goes to help the environment and slow down the progress of climate change.
And given your background, you know, as a physician, this whole notion of health IT and telemedicine made possible, that has to be exciting, right?
It's exciting, but we have to make sure that it reaches everyone. And that, you know, one of the things that probably a lot of people don't know is we started a commission to kind of follow the implementation of healthcare reform, and the implementation of HIT will also be part of that. I know that in my district, together with Puerto Rico, we have gotten some funding to make sure that our doctors and other health providers, not just physicians, are able to access the HIT and have it available to them in their offices. But we have to make sure that, you know, this happens everywhere, especially in the poorer communities. Doctors who are taking care of Medicare and Medicaid patients are limited in their income because of what we've been paying, which will go up with healthcare reform. But so it's not easy for every physician practice to be able to access this. So we have to make sure that we do what's necessary to ensure that in poor communities and rural communities where the financing may not always be as easy for some, that they're still able to have this HIT. It'll make a big difference. It'll bring health care to people in remote areas, specialty care. We've started in St. John some telemedicine. So, and just to give you a little, the Virgin Islands, St. John is a small island. You have to take a boat to St. Thomas if you want to get specialty care, and if you need something more than that, you may have to take a plane to Puerto Rico or Miami. So right now in St. John, through telemedicine, they can get a cardiac consultation or a dermatologic consultation through telemedicine. So they don't have to leave the island always to get the kind of care. So this is what we want to see happening everywhere.
So yeah, this national broadband plan is going to definitely be key, and I just wanted to commend you and your colleagues again, because, it seemed like at the same time that the FCC was beginning the process of implementing the National Broadband Plan, there was this also a focus on the whole internet regulation issue, and it's like, do we have jurisdiction, do we not? And just the recent reports over the last week that, you guys are saying, look, this is what you can do, enforce it 2 years and see if that, passes. But I think that's a huge first step to just making sure the plan itself could get up and running and off the ground.
Yeah.
Okay, well, thank you. We're going to wrap up here. If there are any final thoughts that you'd like to share, particularly, with our audience going into the next few weeks.
I just want people to, really sometimes it's really hard for our communities, the communities that we serve, to see or hear from us. The media doesn't always cover the Black, Hispanic, or Asian caucus events. We've had press conferences where nobody shows up. So I really appreciate the work that you're doing and getting the message out. So I just want to assure people that we are working on their behalf. Our agenda is pathways out of poverty, and working within a group like the Congressional Black Caucus, you have the opportunity to address issues in a very holistic way, because we have people on financial services who are still working on the mortgage problems, who are making sure that banks are going to be lending. We're going to pass a small business bill this week before we go home, probably today. So we have those members. We have members on education and the workforce who are working to make sure that every child will have access to the quality education that the president has said is a key part of his agenda. They have some of us on energy and commerce, I do health, but we have a very holistic approach to helping our communities, to empowering our communities, to give them the tools that we know that they need to improve the quality of their lives. And I just want them to know that we are working very hard and we're not going to give up.
Thank you for not giving up on us. We totally appreciate your service.
Thank you.
Thank you very much.